Good morning, everyone. My name is Philip Reeves on behalf of the Greater Washington Black Chamber of Commerce. Thank you so much for joining us for our next breakfast webinar series. I want to ask our panelists and our moderators to take their videos on and take themselves off mute so we can go ahead and get situated. So before we open up, I'd love to turn over to Antoine Ford, the president of the chamber, to give us some opening remarks.
Thanks, Phil. I appreciate that. I want to welcome you guys to another breakfast series hosted by the Greater Washington Black Chamber of Commerce. My name, as Phil said, is Antoine Ford. I'm president of the Greater Washington Black Chamber of Commerce, as well as CEO of Enlighten Incorporated. I'm excited about this topic today. It's something that's extremely impactful for our businesses. Some people have asked, why is the Greater Washington Black Chamber focused on this? Because it is impacting our businesses at an extraordinary rate. Nationally, 41% of Black-owned businesses have already failed. The impact of this disease and this pandemic is critical for us to understand the business impact, because it's impacting our employees, it's impacting our staff, it's impacting our message. So I want you to really get excited about this, take good notes. We'll come back, make sure you ask questions. This is a great panel. I'll ask, I guess, Phil and Marie Johns to introduce them. Marie, thank you so much for agreeing to host this. I'll be back later today, but Phil, I'm gonna turn it back over to you, and let's get into this.
Great, thanks so much. And Antoine, I think, teed it up well. Today, we have a phenomenal panel and a great moderator. And so today's panel is going to be moderated by Marie Johns, who is a friend of the chamber and a longtime community leader. And so we're really excited to have you, Marie. And so with that, I'd love to turn over to you to sort of take us into this exciting conversation.
Thank you, Phil. Thank you, Antoine. And I just want to congratulate the Greater Washington Black Chamber for the innovative breakfast series that you have developed and really made quite a mark in the quality of the speakers that you have presented through this platform. And I tell you, this morning is absolutely no different. We are so fortunate to have three outstanding medical professionals who are really on the front line in various perspectives in dealing with the pandemic and the egregious effects of COVID-19 on our community. I'm going to introduce them briefly because we could clearly make a session with any one of these three great folks. And so we're going to start off with a few questions to get the conversation going, but we definitely want to hear from the folks who have registered to participate this morning, because your questions and responding to your questions is the most important way for us to spend this time. So I will start by introducing Dr. Anneta Arno, who is a PhD and has a background in public health. And Dr. Arno serves as the director of the Office of Health Equity, which is part of the District of Columbia's Department of Health. And we have heard a lot about health equity these days, and how, particularly in terms of COVID-19 effect on the Black community. And in fact, Dr. Fauci was testifying yesterday at the House Energy and Commerce Committee and talked about the fact that he's very disturbed about surges that are occurring, and a quote from his testimony, "The virus is not going to disappear," end quote. So Dr. Arno, you are our person in the district government who's looking at this, the movement of this disease, and particularly how it affects the city from an equity lens. So would you give us an update on how are things looking in the district? We just opened phase 2, effective Monday. What are you seeing? What's your prognosis? And we'd love to hear you share your views.
Okay, well, thank you so much to Antoine Ford and the rest of the Black Chamber of Commerce for having me on here. I'm delighted to be joined by this very prestigious panel. We have, as you know, been working on the coronavirus. I think we had our first case on March the 7th this year. And since then, we have seen a whole lot of things happen. We did not actually start going into any kind of shutdown or anything, I think, until something like the 16th of March. But a lot has happened since. In that time, we've tested, and a total of over 10,000 district residents have tested positive. As of yesterday, really the 22nd, we haven't yet published the data for this morning. It will come out about 10 o'clock. So I'm giving you the data from the 22nd. We always kind of present the data the day after. 537 district residents have passed away. Yes, I think what Dr. Fauci said is correct. Yes, the numbers have gone down in terms of death. We have, at least that's what we are seeing right now, but we still have to hold the line in terms of doing our best effort. And I think I always say health equity is everybody's work, and it's the same thing for the virus. Everybody has a part to play. We do know, and I was kind of taken aback by the announcement that 41% of Black businesses have also failed. 75% of the deaths that we've had in the district are actually African Americans. Some of my work and many of the epidemiologists at DC Health are looking very closely at what is the underlying driver of those disparate numbers. And it's not, and I just want to say it, and I know all of you know it, it's not the melanin in our skin. I've heard it, I get very despondent when I hear folks all across the country coming up with all kinds of ideas as to why it's something to do with our genes. So when I talk about health equity, one of the things that I say is not only is health equity, health is more than health care. 80% of what happens in terms of our health has nothing to do with, absolutely not our genes, because most of our genes are the same, 99+%, regardless of race. Race is mostly just external, but it's all the other things. So it's the social and structural determinants of health. And I usually say also that structural racism acts as a force in the distribution of opportunities for health. And that includes business opportunities and all the other things that go with that. So I think we can also see that age is a factor, and that has been proven true in the district. Some 83% of folks who have passed away are actually over the age of 60. It rises to up as many as 35% of those are actually over 80. So age is a factor, but it's all the other places in where we live, learn, work, and play that pre-existed the pandemic. And as we showed in our health equity report, that is driving the outcomes. So we did move into phase 2. That is because as a community, we've done a good job of kind of flattening the curve. But we still, as I said, have to hold the line. So as of Monday and the 22nd, we have now moved into a phase where mass gatherings, so to speak, cannot be above 50 people. Non-essential businesses are allowed to open, but with strict limitations, 50% of indoor capacity. Some personal services like tattoos, waxing, threading, electrolysis, etc., can only open if they're by appointment only. And I think these are the things that are more cogent to the business community. And all stations must be 6 feet apart. Indoor dining is allowed, again, capacity up at 50% max. Gyms, health clubs, etc., have a capacity limit, and all of them we have started providing a lot of TA and a lot of data and help for the business community. So outdoor play is allowed. Houses of worship are allowed to open, again with the same kind of 50% capacity, but also to a limit of about 100 folks. So I'm going to stop there. We have a lot of data if you're interested. We've been doing this and building the data on coronavirus.dc.gov. We've added data. We add data every day. We've worked with the business community, and I know Marie Johns and several other folks from the chamber were directly involved in our Open DC task force that we had that ran over 2 weeks, and they were all in fact sector-based. So we were very focused on ensuring that we had the right recommendations, but the lens through all of it was always to ensure that we were opening with equity and thinking about equity all along the way. So that's my kind of opening frame.
Thank you, Dr. Arno. I know we'll be back to you throughout the conversation. But I think that the sobering fact that 75% of the deaths related to COVID-19 in Washington, D.C. have been Black people. And that's a perfect segue to Dr. Reed Tuckson, who is the next panelist that I will call on. Dr. Tuckson is a professional of many years. I won't say how many, but many years in every sector of health and medical care.
Wisdom.
Yeah, exactly. And I'll also note that Dr. Tuckson is a former public health commissioner here in Washington, D.C., and he's been a leader in the public and private sector in healthcare across the country. So welcome, Reed Tuckson. And what I would like you to speak to is the Black Coalition Against COVID. What is it? Why did it start? And what is it that the coalition aims to do?
Thank you so much, Marie. Great to be with the audience. The Black Coalition Against COVID was started 11 weeks ago at a time when DC had 52 deaths from this disease, and our hospitals all across the city were starting to reconfigure their physical plant to be able to accommodate an anticipated surge in patients coming into the ICUs and the emergency rooms. It was a time of great concern of what was about to happen. We knew, and I knew from my time as the Commissioner of Public Health during the height of the HIV epidemic, that it requires, to fight an epidemic or a pandemic of this scale, requires an activated, engaged, grassroots community that partners collaboratively with government, working together to fight. Calvin Rolark, back in those days, the great Calvin Rolark, taught us that no people but a people can save a people, that you have to organize your assets and move forward. So we did that. We brought together a coalition of grassroots leaders from the faith community, from the labor movement, from returning incarcerated citizens, homeless, substance abuse, youth, our go-go musicians, our visual artists. We took a broad cross-section of, and of course, a exceedingly large number of wonderful community-based organizations themselves. And we took all of those leaders together. And I've been trying now to stitch together a community infrastructure where we fight this fight at the grassroots level in partnership with government. We focused on three things. One, the importance of wearing a mask and continue to wear masks, social distancing, number two, and number three, the combination of testing and contact tracing. Let me just quickly say a moment about contact tracing, which we were particularly concerned about because our people have a natural distrust for government invading into their lives. We know that. But if we do not support the ability of testing people at this stage and then finding who the infected people have been in close contact with, and then helping those individuals to isolate themselves so that we stop the spread of this disease, this is the most critical thing for the reopening of the city. We saw that 10 weeks ago, and so we have been assiduously trying to prepare the community to be partners with and accepting the great public health workers that we have doing contact tracing. To conclude, I'll just give you a couple of the things that we've been involved with and then sort of let you understand what we need from you. And we hope that we can be in a partnership with you going forward. We have worked to set up health ministries in churches around the city, and Howard University's faculty practice plan doing testing in one of those 4 churches that we set up. We have been working with the with PSAs on WHUR, WPFW, running regularly. Antoine, you have been wonderful in lending your voice to that. We have put the Go-Go Star, Big G, Antoine Glover, on the side of a buses and in the metro station, wearing a mask and exhorting others to wear theirs. And then we did something very important the other day, 2 Sundays ago. We held a time of remembrance for DC. If Black lives matter, and they do, then Black deaths have to matter. The statistics that Marie and that Dr. Arno gave, we want to put a face to those statistics. And so we had a day of remembrance where we allowed and presented families presenting their loved ones. As you know, when you die of this disease, you die alone in the hospital. And when you're buried, it is without the kind of family funeral that we are used to. And so we had a public funeral, a public celebration. We put faces to those statistics. So as I conclude, I would tell you that we needed to do that because when we started out 11 weeks ago, 52 deaths. Today, you just heard, 537. That's 485 people who have died in our city since we have been organized. So I urge you, help us with 3 things. Number 1, message fatigue is a problem. We're going to have to use the creative talents of our business leaders, our marketing and social media entrepreneurs. Please call me. I need to talk to you. We've got to do better on our messaging. We've got to change it up. Number 2, people are having house fatigue. Of course, they're getting tired. But many of our residents, particularly those who are living in poor environments, are suffering from food insecurity and other social problems. We are going to need a community response more vigorous than ever on community social services support. We need your help. Number 3, We got to protect our frontline workers, the people that are working for you. Regulatory enforcement is key. Let's make sure that we are following the rules so that when people come into our establishments, they are safe, but equally important, that our workers are safe. The last, Marie, I would just emphasize enough. There is not a contradiction between the public health fight and the opening up of our cities and the economic. They go hand in hand. And this false dichotomy that people in the White House are drawing hurts everybody. These go hand in hand, and we are in this for a very long run.
Thank you, Reed. I am a proud member of the coalition, and I would like to now introduce another proud member of the coalition, the noted physician, patient educator, Melissa Clarke. Dr. Clarke is, in addition to being a physician and all that entails, she has written books. She appears with Russ Parr on the Russ Parr morning show across the country. And I so applaud her work to educate patients, to empower them to be better advocates for their healthcare. And so, Dr. Clarke, your work around patient education, patient empowerment could not be more important than in this period of pandemic. So if you would talk about your experience, both as a member of the coalition, but also what you're seeing in your unique perspective that's both national, but also very local because of the fact that you're seeing patients on the front line as well. Welcome, and please, let's hear from you.
Yes, good morning, everyone. Thanks to the DC Chamber and Mr. Ford for having me as a part of the panel and to join these great panelists as well. So yes, I'm an emergency medicine physician. I spent much of my career at Howard University Hospital, actually, and at the medical school as assistant dean. But I'm also involved in something called population health. What is population health? It's really ensuring that healthcare interventions are effective and that we can measure their effectiveness, whether they originate in the doctor's office or whether they originate in a hospital. And or maybe even employer-based interventions in healthcare. So it really, as the panelists have said before, it takes all segments of society to ensure that a population stays healthy. And it's important to make sure that patients are at the cornerstone of every intervention that it's done, that they are part of the decision-making process, and that everything that's done is done with them as part of, as the central focus. And also too, Dr. Arno mentioned social determinants of health. Population health really looks at how can we understand what the challenges are that various communities have to staying healthy. So that's a lot of the work that I've done. And certainly it is clear that COVID-19 intersects because it involves the health of the entire population. So when we looked at the data coming out of China, and I should say my day job when I'm not doing patient advocacy and education now is actually with 3M Health Information System. So I've been looking at the data that came out of China since February, early March. And it was clear from that data that the people who were going to be most at risk were people with underlying health conditions that included diabetes, high blood pressure, hypertension, heart disease, kidney disease, lung disease, autoimmune diseases like lupus, rheumatoid arthritis, sarcoidosis, which we know African Americans suffer from disproportionately, kidney disease, as well as HIV. All of those are the health disparities that you might hear about that African American communities suffer from. So in my 3M work, we've been helping hospitals ramp up and prepare prepare their resources to best take care of individuals in the pandemic. Same with the payer community. We've been helping them as well. And then on my own, I thought it was important to start to get that message out, to sound the alarm. And so that's why I started a Facebook Live, YouTube Live that has really been met well, because there are tons of questions every week. People show up on Monday nights to ask their questions because the messaging has been so unclear from the very beginning. I have to actually shout out DC, because I think The mayor and the public health infrastructure in DC has done a fabulous job. But nationally, I have people contacting me and reaching out on that platform to really try to get that information clear. In addition, I think it's important to say, I too am a proud member of the Black Coalition Against COVID-19. And I work with an organization that Dr. Tuckson mentioned, Leadership Council for Healthy Communities. It's part of that consortium helping to stand up the virtual health ministry. And that virtual health ministry is 4 churches that have actually put together a virtual call center and use a standardized assessment to reach out to DC residents to educate about COVID-19, but also understand what have been the effects in terms of what they need in terms of social services and bridging them back to healthcare. Because the message has been going out from the very beginning, don't go to the emergency department. Doctors' offices have been closed. So you have people who don't have medications, who run out of their medication, who've had chronic conditions that have just been trying to manage and make do at home. So we've been bridging those individuals with Howard University School of Social Work for their social needs, and also Howard University Family Practice and other primary care entities throughout the city using telemedicine and telehealth. So those are some of the initiatives that I've been involved in. And again, the messaging, I think that the business community can help to really put out there is sort of, you work with employees. And some of these employees have been the very ones from Ward 7 and Ward 8, which has been disproportionately affected in terms of deaths. We already heard about the 75% death rate among African Americans in the city being disproportionate. And getting that message out that what your employees do outside of their homes and outside of their businesses actually affect their families, that they take that back home to. It affects your customers if they bring the virus into work. There's an actual economic argument, which is what I think Dr. Tuckson was saying, that if you have healthy employees and you help them stay healthy, there's a greater level of productivity. If you provide healthcare insurance and your employees are healthier, your premiums are lower, right? If your customers stay healthy, you have a healthy customer base. You can get back to reopening in a more timely manner. So there is a truly public health, economic reason to move forward in a responsible manner as a business community. We saw that comedy club in Tennessee where D.L. Hughley passed out. It was packed with people. And I understand the economic pressures that businesses face, but I think it's really important to make sure that we are moving forward responsibly, because who knows how many people he infected in that space. So I'll just close by saying, I'm happy to take questions along with the panelists.
Thank you, Dr. Clarke. So I really want to pick up on a thread that you, in part of your closing, and that is the role of businesses and how they can really help in the public health mandates as it relates to contact tracing. So Dr. Tuckson, I'll ask you, you talked about contact tracing. What should business owners be on the lookout for as it relates to their employees, as it relates to their customers? What role can they play in terms of the contact tracing process? I would like to hear your comment as well as Dr. Arno's. So we'll start with you, Reed.
So the first thing is that you will become involved if a person is identified as having been newly corona positive, and we learn, let's just say that they are an employee of your store, your establishment, then the public health department will want to talk to other people in that environment who have been contained in that space, and will want to know about whether or not they are showing signs of symptoms, what the level of exposure was, how much risk they were under, and whether or not they need to voluntarily quarantine. So there are decisions that have to be made. Your support, number one, in making sure that people feel a welcoming climate for the public health professional is critical. Are people going to be honest? Number two, if people have to quarantine, are you going to be able to help them in terms of the way in which their salaries are paid? Or people going to find that there is a climate where once people know that you have been exposed and you may have to quarantine, you're going to lose your job. So as a result of that, people will not be forthcoming. The virus will spread throughout our community. So I think these are two very tangible ways: creating a climate of support, and number two, being able to have your employees not have rate limiting steps to cooperate with what has to occur.
Thank you. So Dr. Arno, all of this, if I run a staffing firm or a small accounting business or a barber shop, this notion of contact tracing and what my responsibilities are, et cetera, are foreign. That's not what I do. This is all new stuff. What does the health department have in terms of education or information that can help a business owner feel more comfortable in executing in the ways that Dr. Clarke and Dr. Tuckson have suggested?
Well, I think the contact tracing is critical, and I really want to applaud and underscore what Dr. Tuckson said, as well as what Dr. Clarke said. I think even before, I'm just going to step one step back and then go forward. I think the first thing the business community needs to be aware of is all the resources that as a city we are providing. And I do thank Dr. Clarke for saying that we've done a pretty good job. I'm not saying it's perfect. We're learning along the way, but we've put out a lot of information to try to help business owners. We structured the reopening panels, as I said earlier, by sector, and that was deliberate so that we focused in on what different sectors need, including some of the notion of how they would work. So I think we need to start there. So they don't wait until they have a positive case in their work environment and then start figuring out how to talk with the health department. So I like to have people go to coronavirus.dc.gov, reopen, and you'll see lots of resources there. You'll also see we are starting, in fact, tonight, we're having our first webinar, and that's for the places of worship. I can send that info out a little bit later. And then tomorrow night, we have small businesses, and then another group for theaters, etc. So we are trying to be proactive in engaging the business community along the way. I hope that makes them feel, first of all, more comfortable in their role and understanding it, and in opening up and what the criteria are and all of those things, and we're here to help. And then, of course, if they're now comfortable what the issues are, and they're now bringing their employees back, they need to understand what context into which they're going to bring their employees back and what the rules are for PPE, etc. And then if they do have a positive case, one of the things they need to let employees know before they come back and when they arrive is what the individual employees' responsibilities are in terms of being very honest in terms of whether they've been exposed, whether they feel sick, etc. And I think all that was said earlier about that by Dr. Clarke, are we going to create a climate where they feel comfortable in disclosing? So now we get to the point of disclosing. We also have to be a little bit careful. We still have issues of HIPAA, etc. We can't sort of just say, oh, Anneta got sick, and therefore let's tell the whole company that she's sick and she's done this and all of that. Well, it could be, we need to figure out a nice way to, not only just nice, but a legal way in many respects, a legal way to honor people's privacy while doing the right thing. So I want to underscore that as an important part. And then contacting the Department of Health if they feel that they're still not comfortable about what their next steps need to be. So I think those, first of all, start doing the work when you're opening and think about your employees as your critical resource. It's not just your 50% of customers, it's your employees who are critical in keeping you open. And as the Black Chamber, we've already heard the numbers. Even if your employees are not the older part of the population, we also know that our community is more likely to be living closer to family members who may be of all ages and stages, and either they are, and they may not even be living with you, but they may be actually holding down the kids while you go to work. So that could be another way of, they may not be living in your house, but you may give it to your kid who may not show up looking like they're ill, and they take it to grandma, granddad, great aunt, or whoever. So we really, really, really have to own this. I really love what is being said about the important role of the business community in helping all of us understand, and especially our actual being part of the community that is most impacted, understanding all of our individual roles, both in the health and building the wealth and the long-term sustainability of our role in the region.
Thank you. Excellent. So Phil, I'm going to ask you to help me manage the questions. I think we have a few questions that have come in from the audience, and I want to encourage anyone on part of the webinar to please get your questions in. Phil, can you?
Yeah, happy to. And so a few questions have come in, and I'd love to take a second to kind of pick a few of those off.
Thank you.
A lot of questions around sort of the disparity. Curious from the panel, why is there such a high? I mean, I think we touched on it before. It wasn't melanin. There's some health disparity there, but what is making coronavirus and COVID-19 so impactful in a negative way in the Black community? And maybe Dr. Clarke, maybe we'll start with you on that one.
Absolutely. So there's several reasons. One is the economic reason. 4 out of 5 Black and brown people have frontline worker jobs. So at the beginning of the pandemic, we were the ones taking public transportation. We've still been the ones who have been the grocery store workers, the postal workers, et cetera, and have therefore been exposed. And think about it, for many weeks, we were going and conducting our lives without masks. And because that was the information that was being given out. So the first wave really came through the people who were on the front lines. Secondly, I've talked already about the underlying health conditions, which we already knew disproportionately affected people of color, and especially African Americans, but we're seeing it in the Native American community in New Mexico and the Southwest. Because those conditions are there, and then not only the conditions, which are health disparities, but health care disparities. So when we were told earlier in the pandemic, in order to get a test, call your doctor. Well, a lot of people don't have that. Even if they have a primary care doctor, they don't have that relationship with their primary care doctor where they can pick up the phone and do that. And then there were testing deserts. So even in minority communities, it was harder to get a test than in affluent communities. We saw athletes getting tests way before everybody else. So for all those reasons, I think it's important. And then lastly, what Dr. Tuckson said about that mistrust of government and the medical establishment, which has been, for many, many years because of injustices through the medical establishment and research, et cetera. We don't necessarily trust the messages that come from even our public health officials, and definitely the federal government, which has been giving messages from the beginning. So as far as that messaging goes, I think that's really the brilliance of the work of Black Coalition Against COVID-19. I take my hat off to Dr. Tuckson for really being the power behind that, because we're talking about hyper-local messaging, customizing messages to reach individuals from trusted members of their own community.
I would add to that excellent list and really brilliantly dissected. 2 things. One is the active misinformation that is pumped through our community that is of great concern. And Melissa teaches me this all the time, giving me an insight as to the number. There are people who are deliberately trying to create mischief in our community, and unfortunately, we fall for it. The second thing, of course, is that is also that as we try to implement social distancing and staying at home, it's much more difficult, of course, if there's 6, 7 people in a 1-bedroom apartment with 1 bathroom. So the physical housing challenges that we have, there's so many of us who have food insecurity. And so my only point in raising those concerns, those obstacles, is it requires an activated, engaged community to overcome them. we have to be the ones, those of us who can go shop for groceries are the ones that need to be knocking on the door of the person down the road from us who is suffering, and be able to do that shopping for them. This is not going to happen through some magic. It's the community of people loving each other, caring about each other, and being concerned enough that says, let me find out what struggles you're going through, and then let me see how can we help you through our church ministry, et cetera, et cetera.
Absolutely.
And Phil, before you go on to the next question, I just want to add a point here to these excellent responses, and that is, so often the Greater Washington Black Chamber, like most chambers, is an advocacy organization, and something that people who know me have heard me say this often. I think as a business community, we sometimes do ourselves a disservice because we stay focused on what we consider quote unquote business issues. So those are issues primarily related to taxes, the costs, fees, regulatory issues, et cetera. But I think what this pandemic has shown us is that there are other quote unquote business issues where we really have to comment. And so in matters related to public health, matters related to food insecurity and addressing those kinds of community concerns. Those are not social issues only. They are issues for the entire community. And I believe it's a stronger case made when businesses also advocate for equity in those areas, because it affects businesses
Absolutely.
to not have those issues addressed as a healthy community.
That's great. Antoine, I know you wanted to get a point in.
Yeah, so before we go, I see Luigi, a friend and partner out there in the healthcare sector, has a question, but I do have a question generally for all of you guys. If you can answer somewhat quickly. We go to, and Marie, you just brought up a really good point, a practical matter of what's the impact of business. However, many of our businesses are smaller. As an example, we have 2.6 million Black-owned businesses as of the last census. 2.5 have 1 or no employees. So we're really talking about smaller organizations. One of the impacts that we're getting feedback is I can't afford the PPE. I can't afford to sanitize my environment on a daily basis because, as I said in previous panels, that wasn't included in their budget. So you have the practicality of, I know I got to keep my customers safe, with the reality of financial matters. And so from your perspective of the healthcare, and I want each of you guys to look at that, what would you advise them to do? Because that's what they're struggling with now, like the balance between going out of business and doing the best that I can.
Maybe Dr. Arno, maybe we'll start with you on that one.
Yes. So we do, as I said earlier, we've put together a lot of advice, a lot of different packages. We're coming out as fast as we're trying to keep up with the flow. We also have some prep or kind of starter kits that we've put together for different businesses that people can access and take a look at, and then connect folks to where the purchasing. I think there are also some opportunities where we know that a lot of them are small businesses where we could potentially club together to buy those. And I know chambers do that for healthcare services, and I'm not sure if this is one of the things that the Black Chamber could also do. But yes, I think those are the kinds of things that we have put in place, and I can make sure that I send all of the pertinent information. Again, there's a lot of stuff on our website. I mean, we put it all there because it's easiest to get there, but I'll make a list of the things that you're specifically asked about, and I'll make sure to proactively send you the links and send you the information. But the other thing that we could do too is as I announced today, and I'm not even sure it's been probably has been publicly announced, that we have some webinars coming up. I think it would be a good idea I will take on the role of proactively trying to get those to you as things happen so that you can forward them, and any other things that happen along the way.
Excellent.
But I think it's really for, as I said, first start with building a relationship, read the material, build a relationship with the folks in public health, and we all, we have several people who have different skill sets. They also need to work with DCRA and several other folks. So it's not simply just what happens at the Department of Health. I think there are other resources around the city that will connect with that, and that could be a way to make that happen.
Also, Antoine, I think though that within the question there's also, I think, the solution, in that if so many of these businesses are in fact smaller size, then the number of masks that are going to be needed to give to employees is a very small number. And there is no economic barrier for anyone operating a business to be able to afford masks. They're cheap, they don't cost much, and you wash them and you reuse them. So there really is no excuse. As far as sanitizing their place of business, well, that makes sense for the proprietor as well. Nobody is going to want to be walking inside of a Petri dish and then going home and infecting their family. So this is just a cost of business. I don't want to trivialize it, but it is essential. And the other thing is, if you cannot, as a business owner, convince me that you are operating a safe environment, I'm not going to come into your business. And this is the ultimate issue. This is the differentiator in terms of a competitive advantage. And there's one last thing I would say. I don't want to decry or deny or diminish the innovative potential of Black entrepreneurship. This is a moment for thinking creatively, thinking outside of the box. This is a moment for taking risk and being able to think of new ways of operating old businesses. And so I would just urge us to not look at this only from the burden and the hurdle that must overcome. This also, for those who are creatively minded, is an entrepreneurial opportunity. So anyway, but at the end of the day, I think it's a great question, my brother Ford, but this is a function of being able to do business. And we have to start looking at solutions and not excuses.
Excellent.
Thank you for saying that, Dr. Tuckson. I appreciate that.
So, you know, I think I can't help it, like a strategist inside me just has to know. I mean, we've been in this for months now. It seems like there isn't an end in sight. I think from each of you, you all have such a varied perspective on this, and there's a lot of information about, is there a vaccine? When are we going to get through this? You know, how's it all going to play out? And so we'd love, you know, if you all could just sort of cast a bit for us forward. How do you see this playing out, you know, from a more macro level and then specifically locally? And so, Dr. Clarke, maybe we'll start with you. Would love to get your perspective, since I know you have a lot of data at your disposal.
Sure. Well, in the near term, it's not going away. I think we're hearing that all across the board. And a lot of it has to do with our inadequate response on the federal level, the mixed messaging, and then people actually being able to execute on the various behaviors that need to be done that we've already discussed about. But in the long term, I think the vaccine is really going to be what allows us to get quote unquote herd immunity. What does herd immunity mean? So that means that 60 to 70% of the population has antibodies to fight off the coronavirus. But there's a long road to get to that. There have to be well-designed vaccine trials that incorporate everybody who potentially could get the vaccine. So all demographic groups, all age groups, all ethnicities and backgrounds. And that has to then be manufactured, distributed once we know that the science is real and from the research trials. And people have to decide that they're going to take it. So I really don't see that playing out for at least till third quarter of next year. That's my personal opinion.
That's helpful.
So, in the meantime, though, I think this is good news that the death rate is going down. I think that partially has to do with the fact that the medical establishment, doctors, are learning more about how to care for the disease. Fewer people going on ventilators, different medications coming out, remdesivir, for example, in terms of treatment. And so I think, knowing to anticoagulate people when they first get admitted to the hospital so they don't die of complications from blood clots, those kinds of interventions are happening more and more. And so I think we're going to see, hopefully, the survival rate continue to increase until we can get a vaccine.
And Phil, I think the key underlying Melissa's great comments are that we are going to be at this, as she said, for a long time. Third quarter next year, reasonable guesstimate. But those guesstimates for our community depend on a couple of things. Number one, are we going to be coming together in a coordinated way, business, labor, youth, all of us pushing hard to protect us now? Number two, are we going to continue to be victims of the mistrust and distrust syndrome so that we don't cooperate with contact tracing? Or, as Melissa's indicated, when the vaccine is ready, look at the conundrum we're under. We have a community of people who do not trust the scientific establishment, where we need to be participating in the clinical trials to see whether the vaccine works for us. But there are going to be a lot of folks who are going to not want to participate and a lot of distrust. When the vaccine is finally produced, who gets the vaccine first? What is going to be the policy decision? Our business leaders need to be prepared to be vocal about whether or not it's our community that's dying, therefore it's our community that ought to be first in line right after the health workers. But will we have a climate where our people will accept the vaccine when it is ready? And then finally, how do we then get past that mistrust? Now, when we have the traditional flu vaccine, only 35% of African Americans actually take it. So we could be in this for a lot longer than the vaccine is available, because we may be the very community that needs it the most, but will take it the least. This comes back to the message we're trying to give today. It is vital that our Black business leaders are in common cause, in complete harmony and synergy with labor, with youth, with ministers, with returning incarcerated, all of us together saying the same message, pushing together, rowing on the same rows so that we leverage our messages, we integrate them, and it has sustainability. That's what's going to require. But if anybody is hanging around watching from the sideline and is not involved, we will inevitably see this going much more than third quarter of next year.
Wow. Dr. Arno, would love to hear.
Yeah, well, I couldn't have said it better. As I said before, health equity is everybody's work. And I mean that literally, both as whether you're going to take the vaccine, whether you're going to encourage your family, your friends, your worker, your coworkers to take it, really important. The other thing that I think is really critical, if nothing else, this pandemic has underscored the depth of the inequities, not just in healthcare, but across the system. And as I'm speaking to a business group here, but also in the business community. We live in one of the most segregated cities in America, and that's all documented in the Health Equity Report. By every single measure, we are segregated by income, place, and race. Even though DC has one of the highest incomes in the country, when you really kind of shape that out, you start to find out that for the white community, the average median income is $112,000 per year, and this is kind of going back a little bit, and it's $40,000 per year for African Americans. What that means is that even if our folks decide to do the right thing, they may not even be able to afford it. And all of the jobs that put so many of us on the front line that nobody cared about before this came along, and then all of a sudden we become essential workers, right? And we're suddenly, invisible until you become essential. These are the kinds of things that I think I would like to see the business community and the Black business community in particular keep up the discussion about the importance of equity across the board, because it's all of these things that drive our health. We do not want to be back in the same position when the next pandemic comes around. And now that we have to live under these circumstances still, I like the guesstimate, third quarter next year, it means that we are actually least able to manage our current circumstances. Not all of us, I'm sitting at home working from home. We do also know that work from home has been the most important benefit to improving, to flattening the curve and getting us to where we are. But I also know that I have the luxury of sitting here, and many of us on this call probably do, but the postal workers, even some of the people, even within an ER department, because I've done some work in trying to look at that, what you find is they're all working in technically the same circumstance, but you have a different way of going home. You have a different home environment. You have to go to the supermarket. You don't have enough money to order large volumes for once a month. All of those things are what is actually increasing the individual and collective exposure of African Americans and other people of color.
No,
That is a lot of what is really driving the epidemic, and we see that in the numbers, and we expose even the rest of us or the older population who may not be out there or trying, but they are probably the grandparents and all the other things. So that's why we have been so, and we're, as I said, we're still trying to really look at the numbers, because in fact, the numbers that we have suggest that African Americans and other people of color are equal rates in terms of comorbidities, which is what Dr. Clarke started with. And we know we have more of them. So it's nothing unique about our genes. And as I said before, it's not the melanin. It's, you know, I get crazy when I start hearing people coming up with all their other kinds of research that would connect it directly to African Americans, as if there's something unique about our genes and our bodies. But that is not what's driving it. It's the social and economic circumstances in which we live, learn, work, play, and age.
Hey, Phil, I'm going to jump in there for a second. Marie, I want to bring you back into the conversation because of the reopened DC, and we really talked about the businesses. And Marie, you may want to unmute yourself here. So Dr. Arno, when you came and presented to us as a committee, I think I had a conniption because of the data. And because at the end of the day, it was so egregious for me that I think I probably made 15 calls to city leaders and around the area that evening. Marie, I wanted to be curious on advice that we need to do from the business community to kind of keep that, because that should be shock value for folks. People, we heard it, they listened, and we went on, and I'm like, wait a minute. We're talking about things that directly impact our community, impact our businesses. From a perspective, I think one of the statistics you mentioned was that there's a 20-year difference between life expectancy depending on where you live in the city. That is low.
Absolutely.
Well,
21 year difference.
Yes. So Marie, how do we make sure in our community that we keep this thing going? And then Phil, make sure we get to Luigi's question because it's a great one, but I wanted to make sure I jump in on that.
Okay, I'll be very brief. I'll go back to what I said earlier, probably didn't say it as well as I'm with such great articulators here. But as a business community, we have to be concerned about more than just taxes.
Yeah.
We've got to be concerned about what are the public health assets in the city? Where are grocery store? How are we doing zoning and land use that leads to the creation of healthy communities from east to west, north to south? Businesses need to weigh in on those kinds of issues. Education, it's all connected. That's what this pandemic has shown us, is that everything connects to everything else, as Dr. Arno has said so well a number of times. But I think we as a business community are often too siloed and too narrow on our perspective of what's important, and we have paid a huge price for that. We ought to be talking about school systems and the fact that Lafayette Elementary should look no different from minor school in Southeast Washington. We don't do that enough, and that's my charge to my colleagues: is that we've got to care more about just what taxes are going up. We've got to care about the health of the entire city, because it all is going to fall on the business's doorstep anyway. If we shut down because of a health crisis, if we can't hire people because of the inability to work because of sickness, etc. So that's, I think, the critical thing, Antoine, that the chambers and other business voices have to attend to.
Can I add just one thing onto that? Because Black people are dying at a rate 2.4 times higher than white people, 13,000 more Black people would be alive today if we had had health equity prior to the pandemic. And I think there are concrete things that the business community can do in addition to the things that Ms. Johns just outlined. If you have employees, or if you're a restaurant business, offer healthy food options. If you're having vending machines, make sure there are healthy options inside the vending machines. If you offer health insurance to your employees, help to promote initiatives that will keep your employees healthy, boost their immunity, make sure they can get out, focus on their weight and exercise. There are programs that are structured within health insurance plans that boost those healthy behaviors among employees. If you're in the construction industry, there's a whole discipline around what is the environmental impact on a building or a construction that's planned within a community. Be familiar with those and actively voice and participate in those. And then donating resources or expertise to nonprofits that are working to address food insecurity, addiction, mental health, or providing healthcare east of the river. All of those are concrete things that the business community can do today that have a business argument for investing in them and focusing on them.
I would also add, in addition to all of that, I think we talked earlier about creating the right climate. I think an important part of that is ensuring that your employees are proactively encouraged to take care of their preventive health services. We have the luxury in this city of having something like 97% of folks with health insurance, but that alone does not magically make us well. We need, in addition to having all the right health behaviors, we need to access health and preventive health services before these things. Some of us, many of us, too many of us may be diabetic and not know it, for example. And so this is some of the challenge. So I think businesses need to make holistic health a part of their workforce benefit and encouragement. Say, okay, take an hour off, whatever, to go see your doctor or whatever that needs to be. Leave early, whatever. It doesn't necessarily have to be paid. It would be good if it were paid, but adjust your schedule if that's the way it has to happen. I'm just saying, don't put people, and I think that's what happens frequently. They're on such a rigid schedule that they can't go to the doctor's office when the doctor's office is open. Of course, the doctor's offices also need to provide some flexibility, but I think it's a both and kind of an approach.
Yes.
Dr. Tuckson, I don't know if you have any final remarks.
I think I'll just make the remark to what Luigi LeBlanc is asking about. How do we protect the seniors? And so if we add them to the mix of the two analyses we've just heard, let's make sure that we are ensuring that our seniors have the food that they need, that they are, as they are socially isolated, that we're checking in on them and that we are following up on them, if they're families or people that are neighbors. Also, the one way, Mr. LeBlanc, that we need to protect our seniors is stop bringing the virus home when we are outside. So let's just remember, the biggest way in which this thing is spreading continues to be younger people bringing it home to older people inside the house. So we have got to stop that.
Got it. Everyone, this has been a phenomenal panel. I think I wish we could have gone on for another hour on this topic. I mean, you guys have really highlighted and shown how important it is, public sector, private sector, societal issues, demographics, and how it's all interwoven. And I think this has been a theme across all of our webinars, just how, Marie, to your point, the business community has to be a voice in all of these sectors. We have to be proactive and forward in dealing with public policy and making ourselves heard and known. And so with that, I want to turn it over to you, Antoine. I know you think about these issues a lot. You think about the voice of the Black businesses. Would love to have you sort of close us out and give us a bit of next steps.
Yeah, no, I really appreciate this. One of the things that this often brings up is what do we say about this? How do we make sure, and myself and Corey Griffin, the chair, the board chair, is making sure that this is a movement and not just a moment. And I think that's critical in this case. And a lot of people, again, was asking, this healthcare sector, Marie, to your point, why are you guys talking about this? Because it's greatly impacting our businesses. It's greatly impacting the workforce issues. And so we have to continue the message. I think Luigi brought up another additional point. What about the digital divide? So if we talk about people getting healthcare and they're in Ward 7 and 8, how in the world do they get healthcare if they don't have access to high-speed internet? And so I think from our perspective as a community and as a chamber, we need to make sure that we continue to voice, partner with the other chambers, partner with your organizations, and ensuring that we getting this word out. And so I think it's important also, as you guys reach out to organizations that we don't know about, that you put them in touch with us, because we want to make sure that we get the perspectives of all across the entire city of Black businesses, from all aspects, every part, Ward 7, Ward 8, Ward 5, every ward here needs to be a part of what we're trying to do as we collect this information together. This will not be the last time we bring you guys together. One of the things that I think is important is that we now go from having a cross section of folks where we may bring in you as a healthcare provider and somebody else from a telecommunications perspective and then business leaders. So we talk about this integrated environment that we want to talk through. I really appreciate you guys. Again, we will continue in this series. We have a few things planned in the next few weeks. We do want those of you that are here to come and join us. You want to go to Greater Washington Black Chamber website and join us. That's gwbcc.org. And join the chamber. It's a chamber that's growing. It's something that we're part of the U.S. Black Chambers, on a national organization where we have 142 chambers across the country. I serve as the vice chair of that particular board. And so we look at things from not only a Washington, D.C. perspective, but across how other sectors and other chambers around the country are impacted. But obviously, in Washington, D.C., we have the lens of the world on us. So I really thank you guys for the time that you spent this morning. I know it was early, but we try to get people early and get this message out. The last thing we want to make sure you continue to do is that each of you guys continue to get your own message. Give that to us so we can get that to our members, to the people that are a part of us. So we want to continue to be an advocate for you also, because I think it's critical. Really appreciate you guys today, and we'll continue to fight the fight.
Thank you. So thank you to all of you again. Thanks everybody for coming, and we'll see you next time. Thanks again.
Thank you.